The city of Velloe, Tamil Nadu, lies between Chennai and Bangalore. It has a spectacular fort, and increasingly attracts pilgrims to the Golden Temple at nearby Sripuram. However, it is known the world over as the home of the Christian Medical College, a center of excellence in medical services, research and education. CMC Velloe was founded by an American missionary, Dr.Ida Scudder, born in South India in 1870. She spent most of her childhood in the US and was educated there, although her grandparents, parents and most other members of her extended family had served as missionaries in India. This was not the life that she wanted for herself.
I am the daughter of the youngest son, John. I was born in India and lived here until 5 years of age. During the Great Famine in 1875 in South India, it was reported that 3 million people died of starvation. Those were dark days with suffering and death on all sides, and a great impression was made on my young life.
However, one night, while visiting her parents at their home in India, her life was turned around. 3 well-to-do men came to the house one after the other, with the same desperate story. Each of them had a young wife in the throes of childbirth, but unable to deliver. The traditional midwife had been unable to help. However, owing to the social and religious customs of the day, each of these men went away sadly, saying that it was impossible for another man to see their wives. With no doctor to look after them, these 3 women and their babies all died that night.
Dear Diary, last night 3 women died needlessly because I could not do anything. But more importantly, they died without Christ because I did not tell them. Their blood has stained my hands. God, I give you my life. Take it and use it for your glory.
Ida took this as a clear signal from God that she should strive to help the women and children of India. She returned to the US to study as a doctor, graduating from Cornell University Medical College in 1899 among the first batch of women. She started her medical work in Velloe in 1900 using one room in her parents' bungalow as a one-bedded clinic-cum dispensary. In view of her earlier experience, her focus was on women and children. At that time there were hardly any women doctors in India. Gradually her reputation grew, and with it the demand for her services. In 1902 she opened the 40-bedded Mary Taberskell Memorial Hospital, built using funds donated in the USA. In 1924 a new 267-bedded hospital was opened in the center of Velloe, which has continued to expand there ever since. Today there are more than 2,700 beds across 6 campuses, and the hospital caters to nearly every medical specialty. It is equipped with a vast array of sophisticated equipment, including 3 MRI and 3 cord scanners, 2 advanced linear accelerators, a PET cord scan and the latest auto analyzers in the laboratories, campuses. Today, this healthcare organization of international repute includes a network of primary, secondary, tertiary and quaternary care hospitals, with around 3,000 beds spread across 6 campuses in and around Velloe, and in the neighboring state of Andhra Pradesh. CMC Velloe Main Campus or Town Campus. The main hospital is situated in the 19-acre town campus in the heart of Velloe town. The hospital complex is the site for clinical training for all the students. The vast majority of the clinical departments are located on the hospital campus. From April 2016 to March 2017, the hospital, which has close to 2,858 of which 46 are emergency, 207 are in ICUs, 245 are in community facilities, 83 are for long-stay rehabilitation of physically disabled, 25.6 lock-out patients and 1.35 lock-in patients per year. Outreach to 3.4 lock, and daily 8,313 outpatients. 175 operations, 54 births, 2,200 radiological and 48,000 laboratory tests done by here. Housing for doctors and patient relatives is also available at the town campus, which has various amenities like institutional canteens, ATMs, post offices, provision shops, gift stores and so on. In its premises, Other 5 campuses are Scudder Campus, College Campus, Russa Campus, Nursing Campus, Chittoor Campus, and Rinapad Campus. The Kanagapuram Campus, the 7th and most recent addition, where construction is currently going on, will soon be home to a Level 1 trauma center, the first of its kind in the state. Getting to CMC Velloe, the airport closest to Velloe is in Chennai. An airport bus will take you from the airport into the city, from where you can take a taxi to the central railway station. Alternatively, you can go from the airport to the bus stand at Coimbatore. Train and bus services to Velloe are frequent, cheap and quite satisfactory. Either journey takes about 3 hours. If you choose to travel by train, you should buy your ticket to Katpadi, which is the railway station that serves Velloe. Auto rickshaws, buses and taxis are available at Katpadi station for the 7 kilometers journey to the hospital campus. Buses from Chennai will bring you right into the center of the town of Velloe, within walking distance of the hospital. The most convenient, but expensive mode of transport from the airport at Chennai to Velloe is by taxi. If you require a taxi to pick you up at Chennai Airport and bring you to Velloe, kindly indicate so. Train from Kolkata. There are 12 weekly trains and 1 daily trains that run from Howrah Junction to Katpadi Junction, covering the shortest distance of about 1,445 kilometers by Howrah Yeshwanthpur Express. Among the trains that operate from Howrah Junction to Katpadi Junction, 4 trains start from Howrah Junction and 8 trains start elsewhere and pass through Howrah Junction. Seat allocation for MBBS. The number of seats in CMC Velloe for MBBS is 100. However, among these seats, 16 are open for students from all India, while the remaining 84 seats are sponsored. Medical services. CMC has over 9,000 staff, including 1,656 doctors and 2,646 nurses. Most of these people are involved in providing medical care, although they may also have teaching and research responsibilities. CMC is particularly well known for certain departments such as gastroenterology, neurosciences and hematology. A history of firsts. CMC's outreach and commitment to the underserved is complemented by its record of clinical excellence, including many firsts in India. College of Nursing, 1946, successful open heart surgery, 1961, middle ear microsurgery, 1961, Rehabilitation Institute, 1966, kidney transplant, 1971, first bone marrow transplant, 1986, first carotid bifurcation stenting procedure, 1996, successful ABO-incompatible renal transplant, 2009, firsts in the world, reconstructive surgery on leprosy patients, 1948, Neurological Sciences Department in South Asia, 1948, transseptal carotid stenting procedure, 1996, transjugular mitral valvuloplasty procedure, 1996. Thank you for watching this video.